What if the pills in your medicine cabinet or your parents were silently increasing the risk of dementia? It's a terrifying thought, but a crucial one to consider. Many common, over-the-counter, and prescription drugs taken by millions every day carry a hidden connection to cognitive decline. Today we're going to reveal 9 types of medicines you need to be cautious about. This isn't about scaring you, it's about empowering you with knowledge so you can have the right conversation with your doctor. Dementia is one of the greatest health challenges of our time, affecting tens of millions of people worldwide, with that number projected to triple by 2050. While genetics and lifestyle play a huge role, a growing body of research is shining a spotlight on the chemical impact of certain medications on our brain health. These aren't obscure drugs. They are pills for allergies, heartburn, sleep, and pain that countless seniors rely on daily. Even if you or your loved ones feel perfectly fine now, the cumulative effect of these medications could be silently altering brain chemistry, potentially accelerating memory loss over the years. The connection between some medications and dementia risk is a serious topic that deserves our full attention. Before we dive in, let's be absolutely clear. This video is for informational purposes only and is not medical advice. Do not, under any circumstances, stop or change any prescribed medication without first consulting your doctor or a qualified healthcare professional. The goal here is to open a dialogue, not to make unilateral decisions about your health. Abruptly stopping some medications can be dangerous. Your doctor can help you weigh the benefits and risks and explore safer alternatives if necessary. Now, let's get into the 9 groups of medications to watch for. First on our list are common allergy medications, specifically first-generation antihistamines. Think of drugs like diphenhydramine, the active ingredient in Benadryl. While effective for sneezing, itching, and hives, these drugs have strong anticholinergic properties. This means they work by blocking acetylcholine, a key neurotransmitter in the brain that is essential for learning and memory. Imagine acetylcholine as the brain's messaging service. Anticholinergics essentially disrupt the signal. Consistent long-term use has been strongly linked to an increased risk of dementia in multiple studies. The cognitive side effects of drugs in this class can be subtle at first, like mild brain fog, but can accumulate over time. If you're dealing with allergies, talk to your doctor about newer generation antihistamines like loratadine or cetirizine, which don't cross the blood-brain barrier as easily and have a much lower anticholinergic impact. Second, let's talk about stomach acid medicines. This includes 2 popular classes, proton pump inhibitors or PPIs and H2 blockers. PPIs are some of the most widely prescribed drugs in the world for acid reflux and ulcers. While they provide relief, long-term studies have raised concerns. One theory is that by reducing stomach acid so drastically, they may interfere with the absorption of essential nutrients like vitamin B12, a vitamin critical for nerve and brain health. Deficiencies in B12 are a known cause of cognitive impairment. H2 blockers, another type of acid reducer, also have mild anticholinergic effects that can contribute to cognitive issues in vulnerable individuals. The key here is long-term, continuous use. For occasional heartburn, the risk is low, but if it's a daily habit, it's worth asking your doctor if the dose can be lowered, or if lifestyle changes could reduce the need for the medication. Third on our list is a controversial one: cholesterol-lowering drugs, known as statins. Statins are lifesavers for millions, dramatically reducing the risk of heart attack and stroke. The debate around their link to cognitive decline is complex. Some early reports and anecdotal evidence suggested statins caused memory loss or confusion in some patients. The theory was that since the brain is rich in cholesterol, drastically lowering it could impair brain function. However, larger, more recent studies have shown conflicting results, with some even suggesting statins may protect against dementia by improving cardiovascular health and blood flow to the brain. The consensus now is that for most people, the heart protective benefits far outweigh the potential cognitive risks. However, if you or a loved one starts experiencing memory problems after starting a statin, it is absolutely worth discussing with your doctor. They might consider trying a different type of statin or adjusting the dose. Number 4, bladder incontinence medications. These drugs, used to treat overactive bladder, are among the most potent anticholinergic medications on the market. They work by relaxing the bladder muscle, but because they systemically block acetylcholine, their impact on the brain is significant. Studies have shown a dose-dependent relationship, meaning the more you take and the longer you take them, the higher your risk of developing dementia. The impact is so well documented that geriatric specialists are often very cautious about prescribing them. If bladder control is an issue, it is vital to discuss non-pharmacological options with your doctor first. This could include pelvic floor exercises, dietary changes, or timed voiding schedules. These alternatives may be effective without introducing significant medication-related brain risks. Fifth, we have certain types of antidepressants, specifically older tricyclic antidepressants like amitriptyline. Much like the allergy and bladder medications, these operate through a strong anticholinergic mechanism. While they can be very effective for depression, nerve pain, and migraines, their cognitive side effects are a major drawback, especially for seniors. They can cause sedation, confusion, and memory impairment. Thankfully, modern medicine offers a wide range of alternatives. Newer antidepressants, such as SSRIs, generally do not have these anticholinergic effects and are considered much safer for long-term brain health. If you are on an older tricyclic antidepressant, it's a critical conversation to have with your doctor about potentially transitioning to a more modern, brain-friendly option. Sixth on the list are antipsychotic drugs. These are powerful medications used to treat conditions like schizophrenia or bipolar disorder, but they are sometimes used off-label to manage behavioral symptoms like agitation or aggression in patients who already have dementia. This practice is highly controversial and risky. Major health organizations have issued warnings that using these drugs in elderly patients with dementia is associated with an accelerated rate of cognitive decline and an increased risk of death. The cognitive side effects of drugs in this category can be profound. Their use in this context should be a last resort, after all other non-medical interventions have been exhausted and should be managed carefully by a specialist. Seventh, we need to address common sleep aids. This includes two main groups, benzodiazepines and the newer Z drugs. Benzodiazepines are often prescribed for anxiety and insomnia. While effective for short-term use, long-term reliance is linked to significant cognitive problems. They can impair memory formation and recall, and studies have shown a correlation between their prolonged use and a higher incidence of dementia. The Z drugs, developed to be safer alternatives, have unfortunately been shown to carry similar risks over the long term. They can cause a hangover effect of grogginess and confusion the next day, and their impact on sleep architecture isn't the same as natural, restorative sleep. Before turning to a pill, exploring cognitive behavioral therapy for insomnia is now considered the gold standard for treating chronic sleep issues. Eighth are certain pain medications. The most obvious are opioids. Beyond their high risk for addiction, opioids can cause significant sedation and cognitive slowing, which can worsen existing memory problems. But it's not just opioids. A more surprising finding relates to the long-term chronic use of some non-steroidal anti-inflammatory drugs, or NSAIDs. While short-term use for an injury is fine, some research suggests that their chronic use might interfere with the body's immune responses in the brain, potentially affecting long-term cognitive health. For chronic pain management, it's crucial to explore a multifaceted approach with your doctor that may include physical therapy, targeted exercises, and non-opioid medications to minimize the cognitive burden. Finally, number 9 is a summary category: other anticholinergic drugs. This isn't one specific class, but a reminder that this brain-disrupting property exists in many different medications. It can be found in some muscle relaxants, medications for vertigo, and certain drugs for Parkinson's disease. The danger lies in the cumulative effect. A person might be taking a low-risk antihistamine for allergies, another medication for bladder control, and a third for nerve pain, not realizing they are tripling their total anticholinergic load. This stacking effect dramatically increases the overall medications and dementia risk. So, what should you do with all this information? The first step is simple but powerful. Make a comprehensive list of every single medication you or your loved one takes, including prescriptions, over-the-counter drugs, and even supplements. Second, schedule a dedicated medication review with your doctor or pharmacist. Go through the list and specifically ask, could any of these be affecting my cognitive health? And third, always remember that medical guidance is key. Never stop your meds abruptly. Empower yourself with knowledge, have an informed conversation, and become an active partner in protecting your long-term brain health. To recap, we've covered the potential cognitive risks associated with older antihistamines, certain stomach acid blockers, the debate around statins, bladder incontinence drugs, tricyclic antidepressants, antipsychotics, common sleep aids, long-term pain medications, and the cumulative effect of all anticholinergic drugs. The most important message is to talk to your doctor first. Next week, we'll be covering the top 5 natural ways seniors can help protect their memory, even while taking necessary medications. You won't want to miss it. If this video gave you valuable information, please hit the like button, share it with someone who might need to see it, and comment below with any questions or experiences you have. And of course, subscribe for more practical health tips to help you and your family thrive.